Welcome to The Culture. We rest at the pulse of the community, providing all things news, music, fashion, events, and everything that we talk about in between. It's a lifestyle. We are The Culture. Hi, and welcome to the show. I'm your host, Jessica Garrett Modkins, and joining us today is Chief Medical Officer for South Miami Hospital, Dr. Yvonne Johnson. Welcome to the show.
Thank you, Jessica. Thank you for having me.
It's been a nice journey, and I'm happy that we're here back to be able to provide insight to our viewers. Where are we now as it relates to COVID-19 cases? But better yet, where are we with our true measure, which is as it relates to hospitals? What are you seeing?
Yeah, I'm glad you put it like that, because I think there's been a lot of different information that's out there, and some of it we think is reliable, and some of it we think is not reliable. Is it that more people are being tested? Is it that, we're not reporting anymore, the state's not reporting anymore? So I have always gone as my barometer by hospital admissions, because that's what I know is real. That's what I know is correct, because I'm here, I live this in not only in my hospital, but throughout Baptist Health, which represents four different counties, from Palm Beach all the way to the Keys. So what we have seen in the past month of August was such a tremendous influx of patients that it was even beyond what we saw last summer, which was very surprising, because we're thinking that there's a significant number of people that have been vaccinated, and so therefore we shouldn't see this. But what we found was that there's a significant number of people who haven't been vaccinated, and those were the people. The majority of the patients that we saw in our hospitals were unvaccinated people who got very sick. And among the people who have died and who are dying now, at least at my hospital, they are exclusively unvaccinated people. And I'm really very sad to say that we lost a member of our own South Miami family last night, an employee who had worked for us for more than 35 years, who was just beloved here, but was part of our population who has been vaccine hesitant and hadn't gotten vaccinated, and lost his battle with COVID. So we're in mourning here, but I want it to be an opportunity for us to really address some of the concerns that the vaccine hesitant have, because that's what this pandemic, this portion of the pandemic, this month of August, where we just saw this tremendous mountain of patients come through the hospital, that's what this has been about, is the unvaccinated. And so all of this, so much of this illness and all of the deaths so far for us, we all see as being something that was preventable.
And how does that relate to Black people in that observation as a community?
Yeah, it's interesting, because the folks that seem to have the highest degree of vaccine hesitancy are, at least from what I've read, are white Republicans, particularly kind of the Trump type white Republicans, and Black people. And so I say that it's like very strange bedfellows. These are not political compatriots typically, and yet their stance on the vaccine seems to have some comparability. So I'm not really sure. I think it comes from different places. But I think maybe some of the commonality is just a distrust of some of the system. So a distrust of government on one hand, or the current government, and a distrust of the system in general, and how we have been treated, as Black people historically. And, one of the messages that I have really tried to get out, particularly to Black people, because everybody throws out there the whole concept of, Tuskegee. We were experimented on, and, we didn't know we were being experimented on. And so we're not going to be experimented on again. This is an experimental vaccine, and I'm not going to be the guinea pig. And I can appreciate the skepticism for being treated as a guinea pig. But what I have to say about Tuskegee is that the experiment was to deny us the treatment. So the experiment was to give us a disease and see, well, let's just see what happens if, these folks have syphilis, and what happens if you don't treat it. And, when the experiment started, they didn't have penicillin, but this experiment lasted for a couple of decades. And so, before the experiment was finally ended, there was penicillin, there was a treatment for syphilis, but they didn't give it to us. And so the parallel to me is that we are continuing in that mission of denying ourselves the treatment for a disease, or at least in this case, a vaccine that can help prevent the disease. And or if you are one of those few people who suffer a breakthrough infection after having gotten the vaccine, you're denying yourself the opportunity of having a much milder form of the illness. And what we absolutely know is that people who have been vaccinated aren't dying from COVID. So, I've had people ask me, well, what's the point of getting the vaccine if, you still could get COVID? Well, what about not dying? I think that's a pretty good rationale for getting something, is to prevent you from dying. So it might not prevent 100%, and it's never said that it would prevent 100% of preventing the illness. Initially, it had a 94% efficacy rate, which means, even in the early trials, there were at least 6% of the people who took the vaccine. So 6 out of 100 who took the vaccine still got COVID, but they got a much milder case of COVID. And we've also seen that as the months go by, that there seems to be a diminishment in the efficacy. So the antibody levels have seemed to come down. So for those of us who were vaccinated very early, and I was vaccinated in December of 2020 and had my second shot in January of this year. So it's already been 8 months really for me. And it's time to get that booster that they're talking about. So that's what's coming. So we have seen that, little by little, there has been a diminishment in the level of protection. So you are seeing people with breakthrough infections. But among those people, most of them are not ending up in the hospital, and none of them are dying. So I think that's an important point for people to understand. And, I think also part of the rationale for people not to get the vaccine or to be hesitant about the vaccine is that it's relatively new. It's only been about 1.5 years since it first started being tested. And I understand that. But what people should understand is that the platform for these mRNA vaccines, which is a new platform in vaccine, that technology, the science behind it, has been around for years and is just now being applied, in this case, to a vaccine. But the science behind an mRNA vaccine has been around and has stood the test of time. And what is unique about an mRNA vaccine, so that is Pfizer, that's Moderna, is a traditional vaccine gives you a little bit of the virus in a form that it can't hurt you. So, when we get our measles or mumps or rubella vaccine or a hepatitis vaccine, it gives you a little bit of the virus that has been changed in a way, we call it attenuated. So it's either a killed virus or it's an attenuated live virus that just allows your immune system to respond and develop antibodies, but it's not enough of the virus to hurt you. But the really cool thing about mRNA viruses like Pfizer and Moderna is they don't even give you any of the virus. They give you a message to your cells to produce the antibodies. And so it's a new technology, but it's not even putting you at risk of actually getting any virus in your body. So, I was very excited when I heard about that to feel like, oh, this is a great way of developing immunity, because you don't even have to take the risk of, getting the virus put into your body. This is, just a message sent to your cells to develop those antibodies and produce those antibodies. So, I absolutely understand why people are like, this is new, I don't know. But the fear that I have for so many people that I have seen over the course of these 18 months, and in particular over the last month since this Delta variant has really taken hold, is that the known of the disease, the risk of the known of the disease outweighs the unknown of the vaccine. We've now had this vaccine given to hundreds of millions of people across the world, and we're not seeing significant side effects. I'm not saying we're seeing none, but there's no medicine that you take. You can't take penicillin. We in the ER, I see people come in, all the time who break out in a rash or have some other allergic reaction from taking penicillin. Or taking some other medicine, taking aspirin, and you develop ulcers in your stomach because you've taken too much aspirin, or abnormal bleeding because you took ibuprofen, Advil. So there's no medicine that has zero side effects. But to have so many millions of people take this vaccine and have so few side effects, it's certainly the data shows that it's much safer than getting the disease, because now we're not seeing just older people or people who were, sick, getting very sick from COVID and dying or having to be intubated. We're seeing people who are in their 20s and 30s. And, as I'm sure you've seen on the news, we don't admit pediatrics, but I'm sure people have seen that the pediatric hospitals are filling up with even children who have COVID. So, this Delta variant is a whole another animal. And I think it should cause us to make a different calculus than we might have made back in January or February or March when the vaccine first became available to most people. I can understand, especially young people saying, I think I might want to wait. I don't know. I think I would survive COVID really easily if I were to get it, because it's not really doing so much to young people. But that has changed with this Delta variant. So, you really have to make a new calculus and understand that while, yes, you don't necessarily know what the long-term side effects of the vaccine are, you absolutely don't know what the long-term side effects of getting the disease are either. And we know in the short term, young people, old people, sick people, healthy people are getting very, very sick, and many folks are dying.
As you said, there are variants that are continuing to come. How does that affect a vaccination that I believe it is not the correct, I guess, how do you say it? Vaccination or inoculation for that strand? How does that work, and how effective is that?
So, the question is, of these breakthrough infections that we're seeing, so people that got vaccinated and yet they're still getting COVID, is that because the Delta variant is not very susceptible to the vaccine, or is it because time has just passed? So, I don't think we have an excellent answer to that. What we know from some of the studies that they've done is while the Delta variant does seem to get around some of the people who've been vaccinated already, it's holding up pretty well. So the vast majority of people who were vaccinated just, with the original vaccine, are not getting COVID, even with the Delta variant. So it may be a little less protective from the Delta variant, but it does have some protection. However, there are studies being in development now that are looking at vaccines that are specific for different variants. So, I know there's studies that are looking at a vaccine specific for the Delta variant. There are vaccines that have been developed specific for some of the other variants, like the South African variant, and they're looking at that. They're giving a cohort of people, a group of people, the same vaccine that they got back in January or February or a year ago, because some of these people were involved in the studies, the original studies, even before the vaccine was approved. They're giving them the same vaccine that they got the first time. They're giving them a booster of one of the other new variants. And so they're going to study that and see if it makes a difference if you are vaccinated against us, more specifically. But what we do know is even the original vaccine is still protective against the Delta variant better than not being vaccinated. So it's definitely not equivalent to saying, it's a mutated virus, and it doesn't make any difference to get vaccinated because it's not going to cover me. That is not what the data shows. The vast majority of people who are getting COVID are unvaccinated. There are a small number of breakthrough infections, and there's an even smaller number of those who end up in the hospital. And our experience here at South Miami is that 0 of them are dying.
This is a question from one of our audience members. They were diagnosed with COVID. They then received a negative diagnosis, and they were curious to know how long do they have to wait before they can go and receive a vaccination?
So there's no real time that you have to wait from getting a diagnosis of COVID. What we ask you to wait is that period of isolation. So we know that you may be infectious for up to 10 days from the time that you first notice symptoms of COVID. So we don't want somebody who's just been recently diagnosed with COVID or recently had symptoms within the last 10 days to go and potentially expose the person who's going to vaccinate them to COVID. So we want you to at least wait those 10 days. And that's really it. There are a lot of people who say, well, I'd like to, kind of wait a little while because, we know that for at least some period of time, the time period that I've been most familiar with is about 90 days that we know you have your own antibodies from having gotten COVID. So it's probably not a rush to go and get vaccinated. But you can. There's no reason not to get vaccinated as soon as you're not a danger to somebody else by being out and about. As soon as you're not infectious anymore, you could go and get vaccinated.
I also had another question. I've been reading a number of publications, and I see this over and over about an oxygen shortage. What does that mean? And is there anything that we need to be concerned about?
Yeah, so what that means is that we've had so many patients in the hospitals throughout Florida. And one of the main reason that you have to be hospitalized for COVID is because you have a low oxygen level. You're not able to get enough oxygen just from the atmosphere. So you have to get supplemental oxygen, either in your nose or be on a mask or be intubated. And one of the ways that we use to treat COVID, particularly in those people that we're trying not to have to put on a machine and intubate them, is something called high flow oxygen. So it uses a lot of oxygen to give them to get them the amount of oxygen that they need to have normal oxygen levels. So we have had when I think when we started this last wave, we probably had just a little over 100 patients in our health system, in Baptist health system. When we peaked, we had over 1,000. So you can imagine that our oxygen demands went up that same, 10 times. And that's all over the state. This wasn't just Miami-Dade or Broward County, all over the state. We were surging. And so hospitals all over needed more oxygen. They were using more oxygen per day than they ever were. And so, it was just very hard to get those supplies. It's not, nothing has an infinite supply. So, our oxygen suppliers are trying to make sure that nobody runs out, which means that everybody just gets a little. And, you get enough so that you're still sweating, hoping that you're not going to run out. But, it's enough that fortunately we never did run out. And while we're still managing that, we had to do some really significant conservation measures of trying to make sure that, we only gave people the amount of oxygen that they really needed. So, if we had you on just, the nasal cannula with a couple of liters of oxygen coming through, we might come back and test you and say, let's see if you really need this oxygen. Because, if you don't, we can't afford for you to utilize that. So we were really trying to do a lot of conservation measures to make sure that we were not wasting any oxygen. That, when you left the room to go for a test, that we made sure that we turned that oxygen off. And it wasn't just, draining for no reason. So we had to institute lots of measures to make sure that we had the oxygen that we needed for what patient, in order to treat patients appropriately. And fortunately, we were able to become much more conscientious about our conservation and to step that up so that we never did run out. And we're continuing, like I said, right now to utilize those same conservation measures because, we still have many more patients in the hospital than we did, say, in June and early July. But the good news is we are seeing less patients in the hospital now at the start of September than we had a couple of weeks ago in the middle of August.
Dr. Johnson, what do you say to those who have the belief that masks don't work?
I say that they're not accepting real science. We've known long before COVID that masks work because we utilize masks in the hospital. That's was our typical wear in an operating room. So it was right up there with, washing your hands and putting gloves on so that you didn't contaminate a patient's insides with the germs on your hands. By that same measure, we have always worn, a surgical mask so that we don't breathe or, have spittle come into the surgical field of a patient and, take along with it all of that bacteria or whatever else is in our mouths. So, we've always known that. We've known that when we have had other types of infections. So tuberculosis, you never walked into a patient's room who had tuberculosis without putting a mask on. When all kinds of different respiratory illnesses, we've used masks to protect ourselves and to protect the patients from us. So if somebody was severely immunocompromised and they didn't have their own immune system, wasn't working, we always put a mask on to protect them from whatever was in our respiratory system that might get them sick. So that's something we've always known. This is nothing new. And so we know that COVID-19 is spread in droplets that come out of our mouths. And what I tell people is, next time you're talking to somebody like next to a window or a light, kind of talk to them in their profile and see how much spittle comes out of their mouths just from talking. It's just normal They don't even have to be eating and talking, just talking. And less more if they're talking loud. It's just kind of, and it's a very fine spray. You probably don't even feel it, but when you see them in profile, especially if the light's behind them, you're like, "Ooh, all that's what's coming on to me," and that's what's coming on to you. So this, if nothing else, is a barrier from that, because if they have COVID, then all of those little droplets are infected with the COVID virus. And so, this helps you. If you have it on, it's going to keep it from getting right into your face. And moreover, if they have it on, it's going to keep them from projecting that out to you. So we know that if it's mask to mask, and I can tell you in the hospital, we would not be functioning if we didn't wear masks all day, every day when we're with each other. Right now, I'm not in a mask because I'm in my office all by myself. But if someone were to walk in here, I'd have to put my mask on. Because what we know is if that person has COVID and they find out 2 days from now that they had COVID, but they were sitting in my office here with me today, if we didn't have masks on, I'd have to go home. And we couldn't have functioned with nurses sitting right next to each other and doctors all next to each other if one of us ends up with COVID and then all of us have to go home as a result of that. So, we know that none of us got COVID here at work while we were wearing our masks, because that's why we're all still here and functioning. We would have had to shut this place down 18 months ago if masks did not work. So they work. My message, particularly for those parents who may or may not have a choice as to whether or not they put their child in a mask, is, our kids deserve an uninterrupted school year. And that's the way that we're going to guarantee them that, they can keep going to in-person school, is if they don't all have to get sent home the moment one kid comes down with COVID. So, it has worked for us. That's what I can tell you. We've been here every single day. You didn't hear about South Miami Hospital or Baptist or Jackson or any other hospital shutting down because they had a COVID outbreak. We invited COVID into our business and we didn't have to shut down because we wear masks. So I know it works.
Excellent point. Are there any treatments for COVID besides the vaccine?
So one of the things that I really want to make sure that people know about is, are these monoclonal antibodies that, whether you've been vaccinated or not, if you do get COVID and you're not so sick that you have to be hospitalized, and particularly within the first few days of having been infected or having been diagnosed or having been developing symptoms, that you can get monoclonal antibodies that have been shown to reduce the risk of hospitalization significantly. And they're widely available right now. If you go to any of our urgent cares in Baptist, you can get scheduled for the monoclonal antibodies. But in addition to that, there are sites. I know there's one at Tropical Park that the state government has set up that will give you injections. They give you subcutaneous injections of the monoclonal antibody. And that is one of the things that can help. You're still going to have a COVID infection, and we have seen people that still needed to be hospitalized, but kind of like the vaccine, it significantly reduces the number of people that get it, that have to come into the hospital. I will tell you that I do not see it as a substitute for the vaccine, because now you're still getting, a medicine, a treatment that is under emergency use authorization. And, now we know we have at least one vaccine that is FDA approved, but the monoclonal antibodies, they are still under, emergency use authorization. And you got COVID. So, you have to, you're going to have whatever the long-term symptoms, the short-term and the long-term symptoms of COVID are, plus the monoclonal antibody. So it's not a substitute for not getting the disease. It's not a substitute for getting a vaccine and choosing not to get the disease. But if you still happen to get the disease for whichever way, whether you're vaccinated or not, it is an appropriate treatment to help prevent you from getting very sick. And then we also have treatments for those people who are so sick that they end up in the hospital. Remdesivir is a 5-day treatment that people get in their veins. Steroids we are using for patients who are sick enough to be hospitalized. What I do want to emphasize is there's a lot of misinformation out there about some things that theoretically work that we know don't. So, back in the day, it was hydroxychloroquine, when this first came out and people were getting that from their doctors. There's no data to suggest that hydroxychloroquine works. Now there is, anti-worm medicine that people are taking and getting toxicity from, because a lot of them are taking the animal doses, of the medicine, and that's not appropriate for human beings. So, none of those medicines have any data to suggest that they work, and they have been tried out. They have been tested. There have been trials for them, and there's no data that it works. So we have overwhelming data that the vaccines are safe and effective. And it just makes me, very crazy that people are willing to take things into their bodies that have no data behind them, that, we know are making people, putting people at risk, and they're not willing to take what, we know does work. So, my recommendation is, believe in the science. We are not, as Black people, being experimented on with this vaccine. And I will tell you that in my position at South Miami Hospital at Baptist Health, I had non-Black people beating my door down when this vaccine first became available. The elite of our community were blowing my phone up to get vaccinated. If anything, the vaccine, whether we're talking about getting your first 2 doses or now the idea of getting a booster, is more of a health equity issue, that we're not getting it as quickly as other people are getting it, rather than us being experimented on. And, we're definitely not the first in line. So, if you're worried about being guinea pigs, there's nothing to suggest that you're a guinea pig, because you're definitely not first as Black folks in our community. Mm-hmm. We were not first in line for the first round of vaccines. I don't think we have been first in line for, the third shot or boosters. I know so many people of means who have already gotten their third shot, and, it's not even approved until 20 days from now. So, there's just no rationale to suggest that we're being guinea pigs. Mm-hmm. This is not Tuskegee, and to the extent that is anything like Tuskegee, it's because we're continuing to deny ourselves the treatment that was denied us 50 years ago for syphilis, or 60 years ago, 70 years ago.
Mm-hmm. So much insight, Dr. Johnson. Thank you so much for being here. We appreciate you as always. And to the Culture family, don't forget to join us tonight at 6 p.m. right here on YouTube Live and Facebook Live for another edition of My 2 Cents. Grab a drink, set your clock for a good time, and thank you so much for joining us. We'll see you next week.
The Culture is produced and owned by the Culture Media Group and cannot be reproduced or broadcast without written consent. All rights reserved 2021.